Drug abuse is seen by experts as overdependence or misuse of a particular drug without medical diagnosis and prescription by a physician. Many adolescents in Nigeria self-destructively depend on one form of drug or the other for their daily activities. In Kano, codeine cough syrup abuse has been a big problem for donkey's years, as both the young, old, rich and poor ingest it out of curiosity, a desire to feel good or reduce stress.
If I get pressure in my head, I take this one. So I take this one. I took it out of frustration because I was betrayed.
The deadly act of codeine cough syrup abuse was not common with women in the past, but now housewives in the ground-up pyramid city of Kano abuse it remarkably. Fatima, 21, is a student in one of the tertiary institutions in Kano State. In the last couple of years, she has been a chronic codeine cough syrup abuser. She consumes 5 bottles of codeine daily to induce a change in her circumstances. She, like many other drug users in Kano State, was lured into the unwholesome act by her peers. She's now addicted to it and finds it difficult to quit.
I tried to stop taking it, but I can't.
Although marketers of cough syrup with codeine remain elusive in Kano State, the authorities are saying no to the random unprescribed intake of codeine by adolescents in the state.
Anything that can make you go out of your sense, go out of your mind, is prohibited in Islam.
You can be arrested if you have just codeine.
Pharmaceutical experts and stakeholders in Kano believe it is difficult, if not impossible, to stop the distribution of cough syrup with codeine in the state, as those affected with the cough-related sicknesses would be deprived of the remedy it provides. Though there is no legislation currently in Nigeria banning the possession, production and consumption of conventional drugs such as codeine cough syrup, a proposal has since been presented to the federal government to regulate the distribution in the states where addiction is common.
We presented a memo to the federal government or to the council to outlaw the production of codeine containing preparation in the country.
Mostly they are imported or brought into the state from neighboring states and also from other countries.
Medical experts in the city of Kano lament that the unprescribed intake of codeine cough syrup by adolescents has specific physical and psychological effects on their lives. They argued that individuals involved in non-medical consumption of cough syrup with codeine even go on to seek more destructive prescriptions later to give them a giddy feeling.
They are illegal without prescription from a doctor. But those in the cough syrup can be obtained without prescription. So that makes it a public drug of abuse for people, particularly women.
Abuse of cough syrups with codeine in the city of Kano now clearly tops other forms of drug abuse. In recent years, Kano has topped the list of Nigerian states where substance abuse is prevalent. Indeed, to say the state has a problem with drug abuse is to say the obvious. Investigation revealed that codeine cough syrup abuse is rampant because it remains cheap and easy to access, though public sale of intoxicants is prohibited in the state. While it is difficult to stop the production and distribution of cough syrup with codeine, if certain measures are put in place by the relevant authorities, the damage being inflicted by unrestrained codeine cough syrup intake can be checked. Ibrahim Isa, TVC News, Kano.